Hello guys, welcome back to the channel. Today we are going to be talking about endometriosis. So endometriosis is a very challenging condition in women. Sorry guys, I'm having cold. A lot of women or some women suffer from this condition, and it has been found that about 1 out of 10 women have this condition. Endometriosis can be so painful, it can be so severe, it can affect fertility, it affects a lot of things when it comes to doing your daily activities. It affects some people's career, it dealt with their mental health, and it even makes some certain people to be suicidal. So this is not a joke. This condition, it is not a joke. So endometriosis is just a condition whereby the endometrial lining, that is the lining of the uterus, the tissue lining the uterus, is found somewhere else outside of the uterus. Normally the uterus has a lining, and this lining is responsible for the supply of blood, the glands, and everything that we need for our period to come out. But in this endometriosis, this tissue will not just stay in the uterus, but it will be found outside of the uterus, which is not supposed to be. This tissue can be found in places like the fallopian tubes, like the ovary, like the bladder, intestine, just outside of the uterus. There are certain signs that you will see or that you will experience as a lady that you will get to know that you're having this endometriosis. One of the most common signs that you will see is severe pain during your period. Severe, like very severe pain during your period. This pain can be so painful, like you can even describe it as excruciating pain, because it can be so painful that some people will not be able to even walk, talk more of doing their daily activities. So this is a sign that you might be having endometriosis. Another sign is heavy bleeding. Heavy bleeding might seem normal, it might sound normal during your period, but it is not normal. It is not normal for you to have heavy bleeding. As a lady, you're menstruating and you are using about 10 pads in a day. It is not because you want to change it because you're not comfortable, but because it is full of blood and you need to change it. It is not normal for you to have heavy bleeding. This might be a sign that you're having endometriosis. Pelvic pain, especially during your period. Normally you're supposed to be having just normal pain during your period, but because this tissue has already attached itself to other organs outside of the uterus, because the reproductive organs, we have it in the pelvic area. So because of this tissue is attached to other organs like the bladder, like the intestine, like I have said. Another one is edema. So edema simply means accumulation of fluid in a particular place of the body, especially the lower limbs, that is the leg. So some women experience this during their period. Their leg will be very swollen, like swollen. This is not normal. This might be a sign that you're having endometriosis. Bloating can also be a sign that you're having endometriosis. You're not pregnant, you do not just give birth, but your tummy is looking like a 4 to 5 month old pregnant woman. Another sign is fatigue. Naturally, you're supposed to be full of energy. I know most times when you're on your period, you can be cranky, you can be irritable, but not so much that you will not be able to do your daily activities. But with endometriosis, you will be drained out, you will have no energy, and you just be exhausted for no reason, and you will not even be able to do your daily activities that you should do for yourself. So this might be a sign that you're having endometriosis. And endometriosis is very difficult to diagnose. The average women, or most women, don't get diagnosed until about 7 to 10 years before they can be diagnosed properly of having endometriosis. Now let's talk about the treatments that are available for endometriosis. Now the first one I'll be talking about is analgesic, like pain relief. So with pain relief, most times you can get over-the-counter medications like ibuprofen, like paracetamol, to use during your period. This will help to reduce the pain that you're having, and most of the time people make use of patches. So this type of patches, now what they do is just to apply it on your pelvic area or on your back, wherever you're having the pain, either on your pelvic area or on your back. Then with this, is going to give you like a soothing feeling, it's going to relieve you of the pain. This one is another treatment option that is available. We also have some hormonal therapies. So this type of therapy is just available to help regulate your menstrual cycle and also to reduce the growth of the endometrium. Endometrium is the line, is that tissue that we are talking about that is growing outside of the uterus. So this hormonal therapy will help to reduce the growth of this endometrium outside of the uterus. uterus. Options that are available are the contraceptive pills and IUCDs and all of that. Also, in order to relieve the pain, the cramping, some ladies also make use of heat compress to relieve the pain. Also, it is advisable that you avoid food that can aggravate the pain or that can make the pain to get worse. Food like alcohol, like caffeine, like sugar and processed food. So whatever food that you know is readily available, like all those burger, soda drink, you should avoid it during your period, or if you can, you should avoid it totally and replace it with vegetables that are rich in iron and other vitamins like that. So there are some surgical procedures that are available to relieve this pain that you have with endometriosis. Mind you, endometriosis is not curable, yet we haven't found any cure for this disease. We haven't found any cure for this endometriosis, but we have some surgical procedures that are in place to help relieve this condition. Surgical procedures like laparoscopy and hysterectomy. In some cases, this laparoscopy surgery is being recommended in order to remove the scar tissue in the body. When they remove this tissue, it is believed to relieve the pain that comes with this endometriosis. While hysterectomy simply means that they will remove the uterus totally. This one is in severe cases whereby maybe all other methods are not effective, and you already know for this treatment to be considered, this person needs to have, you know, maybe complete the family planning. Maybe the person wants to have like 2 or 3 children. This person must have already had those children before considering this type of surgery. And as well, having this hysterectomy does not mean that it's going to cure the endometriosis, because like I said, this tissue has already grown out of the uterus, so it is not just in the uterus. So taking out the uterus might not cure this condition. And I hope this video has helped, and please do share with someone. Please share me out, I really appreciate that. And please, if you have not subscribed, this should be a great time for you to subscribe, because the analytics of my channel makes me to understand that about 70% of my viewers have not subscribed to my channel. So please do subscribe to my channel, and thank you so much, and I will see you in my next video. Bye.